We're going to be talking today about a particular, in a way, building on what was talked about last week, which was engaging communities. This week, we're going to be talking about engaging and improving care for Francophone communities. It's a bit odd that I'm presenting some of these slides, but the measure often of how we're doing as a group is whether we can explain in simple language to folks who don't know the area what those who have incredibly rich experiences know about the domain. So we've had the good fortune to work with three colleagues that are involved in the French language planning entities. Diane, who is representing the group on today's call, Jacinthe and Estelle, and they're both online as well. And we also have two other individuals that we have the good fortune to hear from today, Marcel Castonguay from the Community Health Center for Hamilton Niagara, and Bernard Leduc, who is the CEO of Hôpital Montfort. I'm here with my colleague François-Pierre Gauvin, and we're going to take turns going through some of the slides, and we're going to leave a lot of time to hear from the panelists and then time for the Q&A. So without further ado, I'll just turn it over to François-Pierre to introduce himself quickly, and then I'll pick up from there. So, FP.
Oui, merci John. Bonjour tout le monde. Mon nom est François-Pierre Gauvin. Je fais partie de l'équipe scientifique de RISE, mais aussi l'équipe responsable scientifique au sein du McMaster Health Forum qui soutient le travail de RISE. Je travaille particulièrement au niveau de l'engagement citoyen, mobilisation des données probantes et mobilisation aussi des communautés francophones. Et au sein de l'initiative RISE, je participe particulièrement au niveau de la communauté de pratique. Donc, on va essayer de développer la communauté de pratique francophone. Donc, il y a une plateforme qui est dédiée à toutes les discussions avec les membres et partenaires francophones. Donc, merci, John.
Thanks very much, FP. So for those of you who don't speak French, FP was just describing his different roles, which you'll see reflected here, and also talking about the fact that he is facilitating the French language community of practice among teams. So if you're more comfortable communicating in French on our online platform, we'd strongly encourage you to do so. And similarly today, if you have questions, please feel free to direct them to us in French. So we'll move into today's webinar, which is the fifth of six in this lead up to the October 9th deadline for teams invited to full application. And just a reminder that the recording will be posted on the RISE website under Join Events. The slides are already there, so if you find the slides helpful, we encourage you to share them with others. Some of the context, which was a helpful reminder to me, our colleagues at the French language planning entities shared with us many hugely helpful documents, which we'll come back to at the end, and the slide deck includes hyperlinks to them, so you'll be able to access them readily yourself. But just some key highlights. As I'm sure many of you know, the Francophone presence in this province dates back 4 centuries. We now have, using the inclusive definition of Francophone, more than 620,000 Francophones living in Ontario. That's the largest French-speaking population in Canada outside of Quebec. The inclusive definition is very, very helpful to know. Historically, we've often focused on that first bullet point, people whose mother tongue is French, but the inclusive definition also includes those for whom their mother tongue is neither French nor English, but they have a particular knowledge of French as an official language and use French at home. About 80%, so 4 out of every 5 Franco-Ontarians live in a designated area, and we'll come back to that term shortly and show you a map that describes those designated areas. Whoops. Sorry, I'm not sure. Oh, there we go. Some more context. The absolutely essential guiding policy in this domain is the French Language Services Act from 1986, which came into force 2 years later. It recognizes that the French language is a historic language in this province and an official language in this country. It reaffirms some key points about the French language being an official language both of the courts and in education. It also recognizes the contribution of the French-speaking population to the cultural heritage of the province and the need to preserve this heritage for the future. In Section 5 of the Act, there's some very specific statements highly relevant to Ontario health teams that a person has the right, in accordance with the Act, to communicate in French with and to receive available services in French from any head or central office of a government agency, institution of the legislature, but also in any other office of an agency or institution that's located in or serves a designated area. So that's where it becomes particularly relevant to Ontario health teams if you're a health service provider located in a designated area. We'll jump to the map in a second, but the Act also allows health service providers, including hospitals, to be designated to provide services in French. And Bernard, I'm sure, will speak briefly to that when he joins us as a panelist. So, Carrie, if you wouldn't mind switching to the designated area map. And just a reminder, this is linked to from the slides. You can access them from the link both on this page and from the list of resources at the end of the document. So this is the very helpful map that shows you the designated areas. And you'll see in the legend at the top left, the dark blue is when the whole area is designated under the French Language Services Act. The light blue is when only a portion of the area is designated, and the light blue is non-designated areas. So this is something that we'll come back to a few times over the call, but the map is very, very helpful just to orient you to these designated areas. So Carrie, if you wouldn't mind, we'll jump back now to the slides. And while Carrie's doing that, the next slide is about the 4 questions in the full application that specifically require you to be thinking about engaging Francophone communities and improving care for Francophone communities. So 2 questions from each of those categories. So section 2, question 2.10, how did you develop your full application? And specifically, how did you engage Francophone communities? And question 3.7.2, how will you work with Francophone populations? Then 2 more questions specifically about how are you going to improve care for Francophone populations. So in question 1.3, there is a question about are there specific equity considerations within your population, and specifically you are prompted to include relevant demographics and health status of your Francophone population. And there's a specific reminder there that given the way that the data are currently available, it's acceptable as a proxy to use the LIN subregions for that purpose. Section 3, then, it gets at the very critical question of how will you transform care to better meet the needs of Francophones. So I'll turn it over to FP to cover a few slides, and then he'll point it back to me. So FP.
Thank you, John. So in terms of resource available to support Ontario health teams applications, some of the fundamental resources are the 6 French language health planning entities. So these entities are mandated by the Ministry of Health to improve access to French language health services and also to engage Francophone communities about their healthcare needs and also to provide advice to local authorities in planning healthcare services for Francophones. So we move to the next slides, you'll get the contact details, some of the key contact details within each of these planning entities. So we have the 6 entities listed here. You'll see each are covering a specific territory. So Entity 1, Erie, Saint-Clair, Southwest, and Entity 2, Waterloo, Wellington, Hamilton, Niagara, Haldimand, FLSA, Alveo, Toronto Central, Central West, and Mississauga-Halton. Entité 4, Central, Central East, Simcoe North, Muskoka. We also have the Réseau des services de santé en français de l'Est de l'Ontario, which is covering the Champlain Southeast. And lastly, the Réseau du Musette francophone du Nord de l'Ontario, the Northeast and Northwest territories. So you'll see the contact details that could provide support to the Ontario Health Teams applications, 3 of which Estelle, Jacinthe, and Diane made significant contribution to this presentation today. So, John, I'll turn back to you for the next.
Yep. Thank you very much. Yeah, and I was just looking at Deanne's catchment area, which covers an area probably bigger than most countries in the world, all of the vast area in Northern Ontario. So we'll hear from her shortly. So as I mentioned before, there are 4 questions in the OHT full application that encourage you to think in a systematic way about how you are going to initially engage Francophone populations and ultimately improve care. The first two, so we'll start with engaging first. There's also language there that asks you to include any participatory process or structure involving, for example, French language planning entities and other Francophone groups and how consensus was achieved. So the language of including these groups and consensus comes from the application, but what we've done here is remind you that a critical group in your area will be the French language planning entities and then any other relevant Francophone groups. So those are our key groups for this engagement process. In section 3, when we come to how will you work with Francophone populations, here we've added in the reminder that it's in the design, delivery, and evaluation of services that this engagement will be critical. So just a reminder about Ontario Health Team Building Block number 3, which is about patient and family engagement and community engagement. But the second part of that, community engagement, is what Heather and some other members of the OHT community of practice covered last week. But just to remind you of a couple of key points, this is about engaging diverse groups and through them diverse communities in decision-making and or in the planning, design, governance, and delivery of services. So there are Francophone groups in general, but there's also a lot of diversity within Francophone communities, and this is encouraging you to think about reaching out to those diverse communities, including voices who typically aren't heard, including those who may not be accessing needed services now and who may not have been well treated in the past when they attempted to access needed services in their preferred language. Then, as we also covered in last week's webinar, we went through 3 domains: building relationships, being explicit about the goal, and being intentional in the design. But I just have one reminder slide on that first point to draw out the linkages specifically to Francophone communities. So if you remember from last week, we talked about how a community can refer to groups who share certain characteristics or interests, or whose identity or who identify in relation to an intersection among these characteristics or interests. So given the inclusive definition of Francophones, you won't be surprised to see the mother tongue there. But we've also highlighted ethnocultural background because there are also ethnocultural dimensions to many of the Francophone communities that you will be engaging and that you would need to be attentive to. We also talked last week about different examples of community groups, and we've specifically here given the examples of a Catholic charity serving a Francophone population or a community health center, as we'll hear from Marcel, who is the executive director of a CHC in the Hamilton-Niagara area that is specifically serving a Francophone community. Then if we move on to the other 2 questions in the OHT full application, so with the engagement, what is really essential are engaging the French language planning entities and any other Francophone groups within your area. When we move to improving care, I mentioned before, question 1.3 gets at equity considerations and specifically prompts you for relevant demographics and health status of your Francophone population. While it's not made explicit in the application, it would make a lot of sense, at least to us, to include a list and a description of which areas your OHT serves that are designated areas. So that's why that map is so important to help you understand how the area covered by your attributed population intersects with any of those designated areas. When we move to section 3 and specifically question 3.7, that's where the focus on improving care comes from. And here in a second, I'll remind you about the population health management approach and then turn it over to FP to talk about operationalizing it specifically for Francophone communities. And while the application does not specifically require you to talk about issues like care coordination and system navigation separately for Francophones, it makes sense that that would be part of how you would address that question, because it's not just the case that you would want to provide in-scope services in French, but you also need to think about how you support care coordination and system navigation in French. So just a reminder about population health management, which we covered in a webinar led by Rob Reed. Step one is segmenting the population into groups with shared needs and understanding the barriers they have to having those needs met. So that's where population segments come in, and I'll turn it over to FP shortly again to talk about applying this to Francophone populations. Second, co-designing care that meets the shared needs of and addresses access barriers faced by each prioritized population segment. So again, Francophone populations would ideally be the benefit of targeted in-reach services, proactively offering evidence-based services anytime they come to the health system. Outreach services, so if you haven't heard from or had any interaction with members, French speakers within your attributed population over a period of time, you might want to invite them back in to re-engage them in the health system. And then finally, care pathways, and that's where we can anticipate, because of either the need for acute episodic care or planned surgical care, that people will need an evidence-based pathway that might involve them being admitted to hospital, cared for in hospital, discharged to home care, and then reconnected to primary care. And all of these services would ideally be available to Francophones in French. And then the final piece is stratifying these services to enable their delivery by OHT partners. And this is where knowing who the groups or organizations in your community who are capable of delivering services in French becomes absolutely essential. So FP, can I turn it over to you?
Absolutely. Thanks, John. So here are some examples of how can we improve care for Francophone communities within a population health management approach. One example is to identify Francophone as a key population segment and also as part of other population segments, and be able to identify more specifically Francophone patients. Another one is to co-design an approach to active offer and more generally to communicating in French with the communities. And lastly, to document the French language services capacity of your Ontario Health Team partners, including designated and identified service providers. And by identified, we mean those that provide health services to the public in French in accordance with their existing French language services capacity. Another thing could be also to document programs specific to Francophones, for instance, the Northern Ontario Francophone Psychiatry Program or the University of Ottawa Medical School, and also to identify services accordingly. For instance, aligning Francophone resources to Francophone patients and evaluate their satisfaction with these resources. So additional resources that could be relevant to help you operationalize. As I mentioned earlier, we have the 6 planning entities that have fantastic expertise and resources that can support Ontario health teams, learn about the Francophone communities they serve, and also to better understand French language services in their area. To help you really narrow down very rapidly some information, we have identified here a couple of key resources with hyperlinks. So if you download the PowerPoint, you'll just be able to click on these links and access these relevant resources. The first one is a fact sheet about Francophones in Ontario, which has been developed by the Office of the French Language Services Commissioner of Ontario. The second one is the map that John introduced earlier that shows the 26 designated areas in Ontario. The third one is a guide that was developed by the Ministry of Health that described the requirements and obligations relating to French language health services. And also there's a link to an active offer online training, which is available in English and French, and is basically geared towards those individuals studying or also working in healthcare professions in Ontario. And another source that could be relevant for you, if you look at the RISE website, we have a document which is the RISE brief number 5, more generally about community engagement, but also we're exploring the possibility of producing a RISE brief specifically about engaging and improving care for Francophone communities. So these are 4 related resources. I would then turn to our panelists And I don't know if Diane has been able to reconnect with her microphone. Seems that it's working.
Yep, so I think it is. Yep.
Perfect. Excellent. So I will turn to our panelists. As John introduced them, we have Diane Quinta, who's the Executive Director of the Réseau du Mieux-être Francophone du Nord de l'Ontario, as well as Marcel Castonguay, who's the Executive Director of the Community Health Center of Hamilton and Niagara, and Dr. Bernard Leduc, the CEO of Hôpital Montfort. So I believe we'll be turning first to Diane to share some insights and ideas and tips for Ontario health teams. Diane?
Oui, hello, bonjour, hello everyone. Thank you for having me. As mentioned, my name is Diane Quinta. I'm the Executive Director of the Réseau du Mieux-être Francophones du Nord de l'Ontario, which is one of the planning entities for French language services. My entity is in Northern Ontario. The French language planning entities exist since 2010 and were mandated by the Ministry of Health to do a lot of work with the different communities, but we have three roles in particular. So the first is to engage the Francophone community on their healthcare needs. And disengaging with the Francophone community really helps us to do our two other roles, which is to provide advice to the local authorities in the planning of healthcare services for Francophones within the community. So we've been working and continue to work with the LHINs. And as the transformation of the healthcare system occurs, we will eventually be working and advising the Ontario Health and the regional offices. And then thirdly, our third role is to provide support and to work closely with the healthcare providers to develop their capacity to offer services within their catchment area and their services, their area. So there's a total of 6 French language health planning entities across Ontario. So each Ontario health team will have an entity that's assigned to their region, as our entities are really regionally located across Ontario. So the planning entities, we've worked closely since the beginning of this whole process with groups that have been wishing to become Ontario health teams. And we continue to work with those different groups, those that are going into full application, as well as those that are still in development and still trying to build their teams. Some examples of what we've done in the North, for example, is that we, as we worked with the groups that wanted to become Ontario health teams, we provided language and recommendations with them that they could include in their applications that would express how they would be working with the Francophone community in the future planning of their Ontario health team. It was these recommendations were favorably accepted and put into the applications. And what it's also led to, though, more than just word on paper, is it's led to creating relationships with the different groups. And in certain instances, so for example, in the near North Ontario Health Team in North Bay, we sit at the executive decision-making table as a resource, advising the group on how to ensure that French language services will be taken into account in each step of the development processes. We've also recently created in the North a resource kit to help providers as they're working through their application, their full application, so that they know how to answer those 4 questions. What are the things that they need to be working on? What do they need to be looking at? And if I take, for example, the Sudbury Ontario Health Team, they are using those resources that we provided to be used as a guide in all the working groups and the decision-making processes. If I move to the south, and although I know some of you in Toronto or southerner areas might not call Barrie the south, it's the north, it's actually the south for me. So I'm going to move to the south, and the Barrie OHT, the entity there developed a French language service fact sheet with data on it to help the providers get more information about the demography of their region, as well as the French language capacity of their providers. The entity sits at the steering committee to ensure Francophone lens is applied in completing the application. But more specifically, what that means is that the entity is present in the planning of how the OHT will develop and eventually offer services. And then let's move to the east of the province, so we cover all 3 regions. If I give another example of best practices, we have the Ontario Health Team to be named by kids. That's their name for the moment. They've put in place a number of working groups. One of them is a French language service working group, which is contributing reflections for the complete submission, and as well providing input to all the different working groups within that OHT to ensure that, again, that Francophone lens is being applied to the work of developing the Ontario Health Team. So if we look at how the French language planning entities might be able to help you as you move forward in creating your Ontario Health Team, one of the things that we can do is obviously we can be part of the planning structures, which is stuff that we're, what I've expressed already, that we're already doing. We can share data on Francophones by sub-region. We can also share data regarding Francophone needs and facilitate engagement with various Francophone community groups within your catchment area. Finally, we can identify the French language service capacity of the health service providers within each OHT because we use, and many providers probably already familiar with the Aussie capacity reports, but we use the data that's captured in that Aussie data report to find out what the capacity is within each individual providers, which we can then use to amalgamate and provide information for the Ontario Health Team as a group. And maybe if we can touch briefly on some of the things that you need to be aware of as an OHT as you move forward, is understanding the Francophone community and its healthcare needs. That's an important point because if you understand the community, the needs, you can better offer services. Know and understand your requirements under the French Language Services Act. As we've already spoken about in the presentation, John mentioned the designated regions. Well, the designated regions, there are certain responsibilities and requirements within those regions to serve the Francophone population. There's designated and identified health service providers. So when we look at the identified providers, we're looking at providers that are working towards their designation. And this is an important thing to know about because it's how we're going to ensure that continuum of service throughout the OHT is working with those designated and those identified service providers that are within your OHT. And then after that is knowing what the capacity is within each of those different service providers. And again, that information is available using Aussie. So as you develop your model of care, I'd just like to mention a couple of final things here, things that you need to keep in mind as you move forward developing your Ontario Health Team. The first thing is the identification of patients. So here I'd like to suggest the use of the linguistic variable. So if you haven't heard what the linguistic variable is, I'm sure your planning entity would be happy to tell you all about it. But basically, there are two questions that we ask as patients and individuals come into the service to find out if their mother tongue is French, and if it's not their mother tongue, which official language are they most comfortable in, French or English? Once you have the identification of your patients, you also need to identify your capacity, and I've mentioned that a number of times, but identify which providers within your organization, within the OHT, can serve those Francophone patients, and then align them. So match those patients with those providers and those individuals' health human resources. Finally, not finally, but in addition, active offer. So it was mentioned earlier, JP, I mentioned active offer. You need to know what it means and how to do it. And the activeoffertraining.ca, great website where you can go and learn more about it. It's an online interactive training, and I think the link will be added to the RISE webinar slide, so you'll be able to take a look at that. And then plan to put in place mechanisms to ensure coordination of care and navigation for Francophone patients. That's one of the big things coming out that's different with the Ontario Health Teams is that navigation for patients, the coordination of care. So put in place mechanisms to ensure that your Francophone patients also have a way to navigate the system towards French services or services that can be offered in French. Identify your gaps and develop a continuum of care of services in French. So once you've identified your gaps, you can better ensure that that continuum of care is created. And finally, you cannot fix what you don't know is broken. So measure performance indicators, measure satisfaction of your Francophone clients. And once you have that, then you can see how to improve for the future. And I think that pretty much covers it for me. So if there are questions at the end, I'll be happy to answer them at that point.
Perfect. Thank you so much, Diane. And now, our second panelist, Marcel Castonguay, Executive Director of the Centre Santé Communautaire Hamilton Niagara. Marcel? I think you just need to turn your microphone on. Perfect. Marcel?
Okay. Are we there?
Perfect. Excellent. Thank you.
Okay, good. Okay, so thanks for having me, John and FP. Following Diane's comments, I'm going to try to speak to you from the perspective of an executive director of a service provider operating and offering services to the Francophone population in a very minority area. So, like, there are some communities in Northern Ontario or Eastern Ontario where French language services of some sort in the health field may be a little bit more prevalent, but I can tell you that in Southern Ontario, that's not always the case. So when we look at the four questions that are being asked today, one, how did you develop your full application? And the second, how are you going to work with the Francophone population? Followed by the equity considerations, and then, how are you going to transform care? I think that those are four fundamental questions that really, really need, to be given special attention and consideration. And I'm really hoping that the ministry is going to be very vigilant in getting the OHT's applicants to have given that consideration to those questions. If we take the first questions, how did you develop your full application? I am really hoping that what we are going to see is OHT applicants that have really identified Francophone population groups, or like French language service providers or agencies that have a capacity to provide services in French, or caregivers or patients, so that we can really show that they have been consulted and that somehow they have been provided the opportunity to provide input into how they see the transformation of the system for the area and for the province, basically providing better services to them, or creating the pathways that we need, like on an ongoing basis. And then, working with that Francophone population, obviously you're going to need to be able to build trusting relationships with those populations, and you are going to need, as far as I'm concerned, to bring them into the fold of the planning process, either, like as a service provider, caregiver, patient, or whatever, in order to make sure that you've got like the ongoing and constant check and balance, whereby you can always go back and make sure that you're continuing to work in the right direction. The equity consideration to me is like a systemic one, and we really need to be able to show in this that the system is beginning to really understand, equity issues, not just as it pertains to the Francophone population, but also to the Indigenous populations and any other marginalized populations. I mean, any of these groups basically represent equity issues, and the applications need to show that the wind of change is really there. That, I mean, that these marginalized populations are being identified. Not that we have completely identified them as of yet, but certainly in the application, we're starting to address the issues on how we are going to identify them. And one of the things that Diane started talking about a while ago was the issue of identifying the patients. And when I'm talking about identifying the patients, like, I would like to go back to the exercise that probably everybody that's listening to the webinar is undergoing right now, and that's the process of filling that OHT application. And when you try to find data pertaining to the Francophone populations, yeah, like we can find the numbers, we can find the designated areas, but there are very, 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 very few documents anywhere in the province that are going to speak to the special needs or to the health needs of Francophone populations in any given designated area. And so I think it's really, really important for the planners and the people that are putting in the applications to be able to give specific consideration as to how in the future and on a go-forward basis, they're going to finally be able to collect the data in order to help them in the planning exercise of being able to create the services if the services don't exist. The last one, the transforming the system, I think is one of the most important ones, and I think that it's one of the areas whereby if all of the applicants got together, they could probably enhance the experience of the Francophone patient in Ontario tenfold in a very short period of time. We keep on talking about care coordination and we keep on talking about navigation, and that's all really good and well. The problem is that you have to have somewhere to navigate them to, and you have to be coordinating their care basically in the language of their choice. And the problem with that is that the system right now is suffering from a very, very large or important incapacity to be able to report to those needs. And for that, I'm going to go back and say, if we take a look at home and community care right now in Ontario, most of it, if not 90% of it, is probably provided by third-party service providers that are under contract to a LIN or to the ministry. And what happens is that many of these home and community service providers have French language in their contracts that in designated areas requires them to provide services in French. One of two things is going to have to happen, like in transforming care and trying to enhance services, for Francophones, is that we're going to have to make that accountability framework much more stringent, and we're going to have to be a lot more vigilant, in ensuring that we hold those service providers to account. Because if we don't, we can do all of the care coordination that we want, and we can do all of the navigation that we want, but basically that's all that Francophones are going to get is care coordination and navigation, but never the service. And what we're after here is the service. And so if in your areas, as you're working through the home and community care piece of the application, I think it's important that you ask the question to the LIN, like whether or not these third-party service providers that have been, designated or identified to provide services, if there is no capacity, then I think it's really incumbent upon the OHT to sit back and say, well, within year one, what are you going to do? And within year two and year three and year four, what are you going to do about it? Because if the services are not there, like I say, there is some importance, in order to be able to provide them. And I say that, from an agency that, services like over 8,500 patients. We have 100 health workers that work in Hamilton and Niagara. And we have a large array of relationships, with other primary care and other community and home service provision. And I can tell you that if there is one area that we are constantly driving on, it is that one, because we know that that is one of the areas, where we can enhance the services and the quality of the service that is being offered to the Francophone population. I think that my coordinates are going to be made available. If anybody wants to send me emails or calls after the webinar, I'd certainly be able and happy to answer any questions. And we'll stay here until the end of the webinar anyways. So thanks a lot for having me once again.
Merci infiniment, Marcel. Thank you so much. Our panelist, Bernard Leduc, who is the CEO of Hôpital Montfort. Dr. Leduc.
So yes, Bernard Leduc. So thank you very much for having me on this webinar. So again, John was saying, I'm going to be speaking a bit about designation, but I think that's been pretty much covered. And the designation process is actually trying to get people to commit about the offer of French services, which I think is very important. Not sure that the map reflects the new definition, the inclusive definition of the Francophones. If you look in, some of the arguments from some teams or from some healthcare providers saying, I've got population, they've got different language, and French is not necessarily the top one, it's at the bottom of the list. But I think if we had data, which unfortunately we don't have, align with the public policy of the inclusive definition of Francophones, we might find out that it's a little bit a bigger concern or a bigger group that needs to be looked at. So that's my first point. The second point is all about, L'Hôpital Montfort is the only Ontario Francophone academic hospital, and our mission is to offer exemplary person-centered care. And I think there's a big opportunity in this transformation of the system about really being person-centered. When we look at the importance of communication and the growing evidence about communication as being, and I'm talking about being able to understand the patient, communicate, diagnosis and communicate and really understand what the complaints of the population is or the patient population is. I think it's important, again, that there's growing evidence about safety and quality and patient experience outcome measures that are significant, especially in some areas like dementia, mental health, but also when you address like a catastrophic event like cancer or other, palliative care and stuff. And again, growing evidence in terms of patient experience, but also evidence in terms of, wrong diagnostic, medication error, length of stay. So it's not just a question of making sure that the teams are really compliant with the French Language Services Act, but it's also a commitment to patient-centered care, quality and safety for your patient. So these things I think are important. Our own OHT, because we're one of 31 that is actually going forward for full application, states in its vision to be, the best OHT in the province, but offering person-centered care in both official languages. And also, I think it's going to be important for all teams to commit to no reduction in services, increase coordination, and increase access. So I think these were the key elements that I think should be looked into and how you define your commitment to that specific population. Where, like Marcel said, I'm happy and my coordinates are there to connect with anybody that want to have some information in that regard. Thanks, and that's the benefit of being the last to talk, is not retaking the other points that the previous very eloquent panelists have done.
Turning back to John.
Great. No, super. Thank you very much. We were very, very lucky to have three superb panelists, and Deanne was in fact presenting on behalf of her colleagues who helped us prepare for today, Estelle and Jacinthe, so we're very grateful. I learned, even though we've been talking about this for weeks, I learned a couple of new things. One was those two key questions, the linguistic variables that were mentioned. Second, the point about the accountability framework. It's one thing to have it written in the contract, but we also need to make sure that service providers can actually follow through on that responsibility to be able to deliver care when they commit to do so. And then Bernard's reminder to us that we're doing this not just because it's a legislative responsibility, but because it's essential for patient-centered care and for quality and safety. So those are all very, very helpful reminders. Given that we already had Deanne's email address listed, and I heard from both Marcel and Bernard that they're willing to let us list their email addresses. We'll just update the slides and post the revised version, so if people want to contact them directly with a focused question, they can. And we've also translated the slides into French, and the slides are also available in French. So if you would like to send us a French language version of the slides around, you can access them through the event listing on our website. So let's open it up for questions. Hopefully there are folks online that want to ask very pointed questions of these three panelists with such rich experiences in this area. Carrie, can I turn it over to you for the questions?
Sure. So the first question that's come in is, are teams invited to full application willing to share their plans for engaging and improving care of Francophone communities? And do any of the panelists have concrete examples of participatory processes or structures to engage Francophone communities?
Great. So maybe, Deanne, do you want to take that second question? And if you want to address the first, you can, but then I can also pipe in on that point.
Sure. So I was just taking myself off mute, but absolutely. So obviously each Ontario Health team working towards their full application could contact directly their French planning entity, which will be the organization to go to help get that information. You know, as I mentioned here in the north, we've developed our own kind of resource kit for our providers that looks at the different questions and how to ensure the Francophone language is covered within that. And then as we work with the Francophone communities on a regular basis, we also have access to a lot of Francophones within the community that are willing and wanting to work and meet with providers to do that engagement. So there's a couple of different ways of getting to that engagement. One is, you know, if you speak to the entity that's already been working with the communities, they'll have a lot of information. And if you want to engage the community, we can always help facilitate that engagement.
Super, that's great. And what I was going to say is that, you know, while at the end of the day, it's at the discretion of the team submitting applications, whether they're willing to share them, our hope as RISE is to contact the teams and see if they are willing to share them confidentially so that we can do an analysis of points exactly like this. So how are people approaching this so that we can start to identify exemplary practices and where there are shared opportunities to move forward together. So this is one of several instances that we've identified that it would be hugely helpful to be able to identify those commonalities and those learning opportunities across applications. Carrie, can we go to the next question?
Yes. So, John, this is likely a question that you may know the answer to. It's for teams that are in development and have yet to receive their data package. Do you know whether the data package will include relevant demographic health status of Francophone populations other than the map?
Bernard and others who've received their package should speak up, but unless I misunderstood the question, the data package that goes to teams does include more detailed numbers on the Francophone population. So, Carrie, was the question for teams in development who will eventually get this package?
Correct. So it's those that have not yet received their data package.
Yes. So my understanding is there will be statistics. I don't know, Bernard, if you happen to have that package beside you, or Deanne, you probably have access to a few packages.
So I was going to answer, and you know, perhaps I can let Bernard answer as well. But the data packages that have been sent out to date have very little information, unfortunately, on Francophone health status. And a lot of that has to do with the fact that the data is just not available. It's not collected. So when we're trying to look at data and compile it and find out health status needs for Francophones, it's just not there because the Francophones aren't being identified at the get-go. So we've been working with our providers in our region to help provide a little bit more information with regards to the Francophone population, given the information we have through our engagement, through our stats, our data and whatnot, but the data packages do not contain very, if any, information on Francophones and stats.
Yeah, I would echo this, Diane. I mean, it's very limited in terms of population. It's more referral from primary care, the data that we have. And again, because it's not consistently collected, aligned with the inclusive definition of the Francophone, it's still very difficult. One of the things you have to understand is that although the majority of Franco-Ontarians are situated in the East, where we do have, significant infrastructure in the East, like La Cité, Le Collège La Cité, faculty of the University of Ottawa, faculties that are often in French, and, Hôpital Montfort and stuff. The forecast is that with new immigrants coming in, which will fall into the inclusive definition of Francophones, the majority of Francophones within the next 10 or 15 years will be in the area of the South, Southwest, and Toronto GTA, so which you don't necessarily have as much access locally or regionally to resources for Francophones. So that's why I think it's important as this population is growing that things are in place. Unfortunately, like Jan said, it's not a variable that's actually collected on initial basis, which we can actually quite truthfully have a clear picture and understanding. There are some ways to get around it, but I mean, it's not as clean as it would be if it was collected at the initial point of contact.
Yeah. Another point that you may want to put in there is, as I was saying earlier, because of the fact that this data isn't being collected or hasn't been collected up until now, these are the kinds of examples of initiatives that OHTs should be committing to in their applications and showing that because of the fact that there is no data, because of the fact that we know there are barriers, we commit to understanding what those barriers are and what those needs are. And, we're going to put a framework to be able to collect that data in place for our region. And hopefully that more regions across the province are going to start doing it. Until it happens, the needs of the Francophone population and other marginalized populations are going to be very difficult to analyze.
Yeah, excellent points. I think this is absolutely critical. I went back to the slide about identifying Francophones, and then what you're all pointing out is the importance of proactively building in data collection mechanisms with this linguistic variable to allow us to better understand the needs of those groups. And as someone has written to me in the private chat box, we really also need to be attentive to equity considerations within the Franco-Ontarian population. So the ways that someone who has come here from Haiti or from some French language, French-speaking African countries or French-speaking countries in the Middle East, they might have very, very different experiences than others. So those types of data can be collected both in terms of this linguistic variable, but also then looking at that cross-cut with some of the other variables that try and capture an equity perspective. Carrie, can we go back to other questions? You and other questions?
Sure. So the next question is just a clarification, and it's whether the percentage of Francophone sent as part of the data packages uses or does not use the inclusive definition.
Deanne, are you able to confirm that?
The information I've seen is that yes, it does use the inclusive definition.
Very good to know. And I should also say,
a lot of the data comes directly from the Ministry of Health, and it's done. It's a little different than the subregions that we're used to working with. So the numbers don't necessarily align with, because they're using different metrics to calculate the data for the OHT catchment area, which isn't necessarily always the same as the subregion. So it's hard to sometimes match it up with the numbers that we're used to using, but it does have that.
And if I may interject, I think it's a very good question to ask the ministry when you get your data to see if it's there, because again, I go back to there's no systemic way of collecting the data according to the inclusive definition of a Francophone. So I guess it's probably variable in the areas where you're coming from.
Interesting, great points. And I should just say, just because I raised the comment in the private chat box about the equity lens, the point was made, it also applies to the panel. And so certainly point taken, we have 3 very distinguished panelists, but not necessarily bringing the viewpoints of people from different ethnocultural communities. So that's something we'll pay attention to going forward. Carrie, can I go back to you to see if there are any other questions?
Yes, so we have one more question that I think we have time for. So the question is, geographic dispersion of Francophone communities often results in services being delivered very far from home. How can OHTs handle this?
I can probably take a first stab at that.
Right.
One of the things that we've talked about, and Bernard can always add in, is the idea of perhaps looking at other ways of servicing the Francophone population with technology. I mean, a lot of services nowadays are being offered through technological means. Coming from Northern Ontario, you know, having a patient, be it Francophone or not, go to Toronto for a follow-up 5-minute appointment doesn't make a lot of sense. So we don't have the specialists necessarily up here, so we have to find a way to offer that service to them. So it's the same thing for the Francophone population. You know, is there a way perhaps of looking at a Francophone OHT across the province that other OHTs could refer to help access to services for their patients? Now, obviously, you know, the day-to-day immediate care, it needs to be done where it is, but follow-up or any type of mental health and addictions or any type of specialist follow-ups could be done via, you know, some kind of technology. So I think there are ways, and we just need to really be innovative in how we're going to look at solutions. Knowing what other OHTs are nearby and what services do they offer, how can we access those services for our regions?
Yeah, and if I can add, I mean, one of the mandates of the academic hospital of 204 that was given was to actually help support Francophones in Ontario and providers in Ontario, and that's something that we're already doing partially. I guess the answer to that is that we will be working with Ministry in terms and other providers, not just MOFOR, but to go that route and support the OHTs across the province to who have difficulties providing services in French or access to Francophone services. And I would say, I think it's probably even more important in non-designated area because the resources there are so scarce and the access to Francophone. Again, if we go back to quality and safety and patient-centered care, I think it's important that we broaden it up to the whole province.
Fantastic. Great comments. So we're out of time. So thank you very, very much, everybody. I actually feel very energized by the webinar about what an extraordinary opportunity Ontario Health Teams present in terms of better engaging and improving care for Francophone populations. And as Bernard said, the motivation at the end of the day has to be the opportunity to dramatically improve the patient-centeredness of our care and the quality and safety. And this is an important way in. And we also have such tremendously rich resources in the province to draw on. People who thought long and hard about this, lived it, and shown how it can be done. And that includes both the French language planning entities and then people based in these designated service providing organizations. So it's in a way a very exciting time. It also will, of course, create new demands on all of these rich resources, but critical to move forward on. So thank you very, very much, everybody, for joining us. Just a reminder that our RISE newsletter, which comes out every month, is also available in French, and if you're not signed up for it, you can sign up on the RISE website, which is at the URL on the lower left of this slide in English and the lower right in French. And we work very hard to make sure that our materials are available in both languages. So that's it for today. We have our final webinar in this series on Tuesday, October 1st, Taking Steps Towards Collaborative Governance. We have Anne Corbett from DLG joining us and Bob Bass, both of whom are very experienced lawyers with a lot of experience in the governance space. So we're delighted to be able to welcome them next week, and we're working with them this coming week to get teed up for that. And then we're going to be meeting with the ministry to talk about what the next round of supports we can start to provide to teams. And a final reminder that the recording from today will be posted on our website probably within a few days. So thank you very, very much to Diane, as well as to our colleagues Estelle and Jacinthe, who were so critically helpful in getting ready today, as well as Marcel, who very helpfully brought a primary care perspective, and Bernard with a hospital perspective. We're very grateful for your time. So on behalf of François Pierre and myself, thank you for joining us. And for those of you who can join us on the 1st of October, we look forward to welcoming you then. So thank you and have a good afternoon. Bye-bye.
Bonne journée.
Thank you.
Yeah.